Unique training is underway in Johnson County so paramedics can care for people who call 911 with extreme emergencies. It's intense, it's realistic, and as our Jenny Runovich reports, it's meant to save lives.
All of those sedation medications can cause nausea.
At the Johnson County Coroner's Office this week, it looks
So we just take this down in.
And sounds.
So we'll make an incision as big as we need.
And feels like an ER.
All right, who wants to start? You're going to open that space and make room for your finger.
Trauma doctors training paramedics for the worst of the worst emergencies when speed and skill in the field make a difference.
It's a game changer. These are the epitome of life-saving skills.
Advanced medical skills for especially critical patients needed well before they get to a hospital. The training is very realistic, learning with actual cadavers, fake blood.
You're going to dissect that bone away from the flesh.
A deer leg for amputation.
I think that it's as close as we can get to the field. You play like you practice, and so the more that we're able to get in here and learn and grow and be confident in our skills, then when that need arises, out in the field, we're ready.
So the paramedics are going through 4 different stations, including this one, where they're learning how to administer medication to sedate or paralyze in case they need to get into an airway.
So there's a station where they're physically drawing up the medication, calculating the dosing, and then pushing those medications.
You take 2 fingers just like this, around like that.
They're also learning how to treat a collapsed lung, perform an emergency C-section, or amputate after a serious crash.
And there have been at least 2 cases in the last couple of years where conducting a field amputation could have been the difference between saving someone's life and not.
It gives you a readout of what your tidal volume that you delivered is.
Paramedics from a half-dozen fire departments across Johnson County are all training together, a first for Indiana.
They show up and say, oh my gosh, I'm glad you're here. I remember doing this with you in training. Let's get this done and let's save this person's life.
Now, if there's an extreme emergency, they're ready. In Franklin, Jenny Runovich, 13 News.
The Johnson County Health Department paid for this hands-on training course, which will continue for the next couple of days.